Welcome, everyone. Welcome to the Irrational Labs prolific collaboration. This is going to be nothing short of prolific, we hope, and maybe hopefully irrational. So for folks who don't know us yet, we hopefully will get a chance to get to know you. We're going to have a fun and exciting, interactive, joyful presentation together where we will share experiments that Irrational Labs has done in collaboration with Prolific. We will be monitoring the chat, so if you have questions in the chat, please put them in there. Please do all the things that you know to do in a call like this, which is put yourself on mute when you're not on. Put yourself on video if you are on, because it's better to speak to a room of faces versus not faces. This is like a selfish ask I'm making on behalf of the presenters. Like, we want to see you. It's more fun if you do that. And we're going to kick off with Andrew from Prolific introducing himself and Prolific. He's going to pass the mic to Richard and Colin, who are going to introduce Irrational Labs. And then we're going to deep dive into this quantitative UX testing that we have teed up for you all. So let me know if you have questions in the chat. Otherwise, I'm going to pass the virtual mic over to Andrew.
Thanks, Kristen. Good afternoon, everyone. Or I guess if you're joining from the US, I guess it would be good morning. It's quite late afternoon here in the UK. My name's Andrew Gordon, so I'm a senior research consultant here at Prolific and had the pleasure of working with the Irrational Labs team on this joint research project. So I'm not sure how many of you will be kind of familiar with Prolific and what we do. So I thought I'd just give kind of a 10,000-foot view of who we are and what we do, and then kind of talk about how this collaboration came about. So Prolific really is, it's basically an online marketplace for participants. So we connect researchers, regardless of what kind of research you're doing, with our pool of participants. Now, we've been going for about 10 years, actually 10 years this April. We came out originally of the University of Oxford. Our two co-founders were studying for their PhDs there. And as most people who've done a PhD realize, it's quite hard to get participants for research. So they built a tool, which at that time was called Prolific Academic. And essentially the idea was, we would have participants come into that tool and then be connected with researchers who wanted to run research on them. So from those very, very humble beginnings, it's continued to grow over 10 years to the point where now we're a team of 150. We've just opened our first US office, and we've got about 160,000 participants in 36 countries around the world. So pretty big kind of expansion over that time. And really the overriding mission of Prolific has been just to improve data quality online. If any of you have done research online before, you'll know it's a little bit of a gamble, depending on where you go. The quality might be good, it might be bad. Our mission is to basically, stop that being the case and just have it all good. And then the way we really do that is we have a bespoke pool of participants, which means it's fully gated. We don't share it with anybody else. If you want to be a participant on Prolific, you have to go through all the kind of same stages you would as if you were applying for a loan at a bank. So that's kind of ID verification, bank account verification, phone verification, all these kind of things. And obviously that takes quite a bit of time, which means we have a waiting list at the moment of about 750,000 participants, which we're slowly kind of chugging our way through and expanding the pool. But once participants come onto the platform, they're measured the entire time they're on there. If they don't perform very well, we kick them off the platform, and that way we keep the quality high. So that's kind of a little bit of an intro to Prolific. As for myself, my background is in academia. So I did a PhD undergrad in psychology, PhD in cognitive neuroscience, and then I was at the University of California doing my postdoc in clinical neuroscience. And then about 4 years ago, I joined Prolific as, I think it was about the 20th employee. And like I said, we're now at 150. So quite a lot of growth over that time. And as senior research consultant, I really work on three fronts. So first is primary research. I do a lot of research on data quality. That's comparing different platforms and panels, but also figuring out the best ways to improve data quality within a survey. So research on attention checks, research on how to stop people using AI when they're doing online research and all these kind of things. I also run as part of that primary research effort, the kind of the polling side of Prolific. The second front I work on is consulting. So working directly with researchers who hire out my time to help them run their research online. And thirdly, and most importantly for today's webinar, I work on kind of partnership research, which really involves seeking out people doing great research, whether that's individuals or teams, people who are doing something really novel, something very impactful, and seeing if we can kind of help them do that novel and impactful research by kind of jumping into the trenches of research with them to produce some great work. And that's really how this collaboration with Irrational Labs came about. So actually, one of my colleagues was listening to Lenny's podcast and heard Kristen talking on there, and she happened to mention that she used Prolific for her research, which obviously set everybody at Prolific incredibly excited because Irrational Labs' reputation had preceded them and we all knew about them. So we all got very excited. One thing led to another. We ended up jumping on a call and talking about how we could do some joint research. And the Irrational Labs team went away, came back with this proposal that would essentially leverage our ability to get these very specific and niche samples and their ability to do really great kind of behavioral-based product research and put them together into this great study, which Richard and Colin are going to take you through today, which is all about how to de-risk product launches by quantitative UX testing ahead of time. I don't want to steal any more of Richard or Colin's thunder, so they're going to take you through the kind of the study. I will hang around. I'll be available to answer questions at the end. But for now, I will pass you over to Richard.
Perfect. Thanks, Andrew. And we're really excited. Colin and I are really excited to share some of this research in this partnership with Prolific. We've been doing this with them for a little while now, and we're excited to share out some of the results. At a high level, Colin and I are behavioral scientists, so we study human decision making, think deeply about how the psychology of decision making impacts the world around us and product design. Maybe just a high level about Irrational Labs. I know a lot of you on here probably know about us, but we've worked with many different companies to apply this psychology of human decision making to product design, and we've done it for over 10 years now. We created the behavioral economics unit at Google, and for the purposes of this, I think highly relevant, we've run a lot of experiments, and so we're excited to talk about this one and this particular approach because there are a lot of different ways that you can think about testing products and specifically behavioral insights about products. And we think this one with Prolific is one that's definitely worth using, applying, and keeping in your toolkit as you're thinking about how to design better products. So here are a handful of our clients. We work across a variety of different domains. And so we're going to talk specifically today about an experiment that we ran in UX testing where we were looking in the healthcare space. But we do this across a variety of domains. We've worked with a lot of large tech companies, a lot of healthcare companies, a lot of finance companies. So again, this is one use case that's specific, but again, we've done this, and we've done this sort of experimentation, by the way, with all types of companies. So just keep that in mind. So at a high level, Irrational Labs uses behavioral science to inform design decisions. Again, really, we focus on understanding our psychologies, our biases, and how they influence what we're likely to do. From there, we try to work with companies to identify what is it that you actually want someone to do. We call this a key behavior. And then we do what's called a behavioral diagnosis, where we map out all of the steps that it takes to get to that key behavior, identify behavioral insights, and then try to design solutions and test those solutions. And so I'm going to talk through a couple of different ways in which we do that with companies and the types of tests that you might consider and why we think this type of test is a really effective one. And so the first thing that we can do is product innovation. So say you've got a product that you like, it's doing well, but there are some things you'd like to improve. Or maybe you noticed you've rolled out to a new customer base and it's not working exactly as you wanted. One of the core ways that we often engage with companies is really identifying how a product works, really honing in on those insights and leveraging those to make product changes that make tangible impacts. The second is new product design. So we often call this 0 to 1. So really, if you are developing a product from the ground up, infusing behavioral science in that product is one of the most effective ways to leverage behavioral science. And for me, that's the gold standard. If you could start from scratch with a behaviorally informed product, you're really, really going to be off to the races and really a step above your competitors. And the third is, and I think highly relevant for this particular webinar, is experimental strategy. And so we think deeply about the best ways to test these insights. So we come up with a lot of insights, we build them into products, but we also think through, how can we actually quantify these? How can we test these? And we think there are a lot of different ways that you might do that. And I'm going to talk about why you might try different approaches. So the first way you might test something, and perhaps what you might think about immediately, is in-product testing, right? And this is really effective for identifying how will someone actually react to a new feature, a new product in the real world. And there's no substitute for that. So we'll just start right there. From a behavioral perspective, this is the gold standard. You release it to the world, run an A/B test, and see how people actually engage with it. What do they actually do? This is really, really powerful. We run, again, dozens of these in-product tests with a variety of companies. Really, really effective and kind of what you ideally want to do. However, there are a number of reasons why these in-product tests are hard, right? So you've got real people, but to set it up, you've got to have an experimentation platform. It can be time-consuming to set these up. Imagine you've got to create different concepts, different products, different features. You've got the technical challenges of maybe getting an engineering team on board. You've got the organizational challenges. How do you get everybody to do this? You've got approval processes, legal. There's a higher risk. Let's say you really want to take a big swing, and you've got to build it out, and you've got to roll it out, and there's so much on the line. So a lot of upsides here to this type of experiment, but also there are a lot of things that can make it harder to do. Now, let's say that you're Amazon and you're running thousands of experiments a day. Boom, you're set. But in a lot of cases, and even with like really sophisticated clients that we worked with that are running a lot of experiments, these types of tests can be difficult. And even if they are very feasible, there are a lot of reasons to try what we call quantitative UX experimentation, or out of product testing. And so this is what we're going to talk about today. And this we think is really effective, and Prolific has been a fantastic partner in this. This type of testing is a really nice way to de-risk recommendations before you actually put them into product. Now, it's important to note that, there's no substitute for how people actually behave in the product, but part of the science of the behavioral science is trying to understand how we can design these types of experiments in a way that gets to an insight that we can apply in product, right? And so while we can't observe the actual behavior, there are ways to think creatively about behaviorally informed variables and measurables that we can actually get to that will inform the product design decisions. And so some advantages of this type of testing that we've done with Prolific are, it's faster, it's cost effective. Again, it's lower risk, right? You can really run pretty provocative things in a white labeled environment. No one will know that these are your particular customers, and you can get feedback and results sort of right away. So we're excited about this type of testing. And when we think about other types of testing that you likely have done or thought about, there's also UX, usability testing, or prototyping. This is a really effective test when you've actually developed a product and you want someone to interact with it. And we have done, by the way, this on many different occasions with a variety of different clients. And there are some real powerful insights here. If you want to understand how someone actually interacts with a product and observe it and ask specific questions live about behaviors that someone does, this can be a really powerful way of gathering feedback. The challenge here, again, is that it's generally a small sample size. You're probably not going to do this with more than 8 to 15 different people. We know from research that samples get saturated anyways, and critically, there's no randomization. And so you can't really show someone a different type of, let's say you have a specific hypothesis, you can't show the same product 2 different ways to the same person and get scientifically valid data. And so you can't isolate your variable of interest. And so even though this can be really effective in sort of understanding how someone might interact with a product, again, you can't get quantifiable data. You can't isolate your variable of interest. You've generally got a smallish sample size and sometimes availability selection issues who might show up for these sorts of tests. And also, are they representative of the types of people that you're interested in testing? And one of the really powerful things about Prolific is their ability to get large samples and representative samples as well. So with that said, we're excited to share with you this example of quantitative UX testing that we did in partnership with Prolific. Again, we think this is a really powerful tool to de-risk something, test multiple different variants. So Colin will walk through our experiment, how we tested different variants to really try to hone in on a hypothesis about how to increase medication recall. And then we're really getting at how do we get specific indicators, specific variables that we think could be interesting and informative in a real product experience. So with that, I'm going to turn it over to Colin to walk through our experiment that we ran and some of our research and talk through how we executed this partnership with Prolific. Go for it, Colin.
Thanks, Richard. Yeah, so Colin West, behavioral scientist at Irrational Labs. So I'm going to talk to you about an example of quantitative user experience testing. And Prolific and Irrational Labs chose a particularly difficult behavioral challenge. We focused on prescription medication adherence. So a lot of patients have difficulty remembering all the critical information about the medications that they're taking, and for pretty good reason. There's a lot to remember. So I'd like you to just think back to the last prescription that you took and think if you can remember all of the critical information. I won't ask you to put your prescription drugs in the chat, but just to yourself, think about, can you remember the brand name, the chemical name, the dosage instructions, and contraindications? These are just the base things that you need to remember to take your medications properly. And if you do bump into an emergency, you can tell the doctor, here's what I'm taking, and you can describe that accurately. So take a moment and think of, like, can you actually remember all of this key information? And if you can't, you're not alone. There's been research that has quizzed people on the medications that they're taking, and they tend to find that over half, the last estimate was 51% of patients in the United States could not remember this basic information about their own prescription medications. And this has really important consequences. It can be really harmful for adherence. Are people taking the drugs as they're supposed to? Errors with taking things and interactions between drugs, and then emergencies as well. So this is a really important challenge. It can be really harmful and something that has been very tricky for researchers to solve. So that's the challenge. How did we approach this? There's been a lot of research in the past that has shown people, different medications and done this type of qualitative research that Richard was just describing, and asking people, hey, would you prefer to get a leaflet like this or a leaflet like that? And they'll talk to 40 people. And we think that that is not the right approach here. We wanted to conduct a real experiment where we randomly assign people to get different interventions and see if we can meaningfully impact their recall of the key medical information. So before I go into the details of how we set up this experiment, let's just think through the challenge a little bit more carefully here. This is a typical label on a prescription medication. There's an awful lot of information here. If you were trying to design a label that was hard to remember the key information, it would look something like this. You typically get this, and you get a leaflet. This is a real leaflet for metformin, a diabetes medication. There's a whole lot of what should I pay attention to? Which of this is information more for my doctor? What is information for me? It kind of stresses me out just looking at these 5 pages. So this is what's currently out there. And medical researchers, they recognize this problem. They've tried to simplify it. So they've tried things like, can I change the label on the pill bottles? And they'll do things like simplifying the language, using larger font, some icons like you can see here, or highlighting some information. So here, I just want you to pop into the chat your estimate for whether this, so let's look at version C here, which involves simplified text and icons. Do you think this led to a meaningful change in whether people were likely to remember the key information? So comparing version C versus version A, what percentage improvement in recall would you predict? So pop into the chat here. Okay, 10%, 3%, yeah. Okay, we're kind of across the board here. Yeah, so 55%, 30, okay. I won't keep you in suspense any longer. They tested these and they saw an increase. So some of you were roughly right here. They saw 3% higher recall when we quizzed patients, as medical research quizzing patients about whether they could remember the key information. And combining simplified text and icons led to about an 8% improvement. Not a huge impact, given that we know that 51% can't remember the key information. So we thought, how can we take insights from behavioral science and do better than 8%? And we came up with two, what we think are some creative strategies to do this. The first one we'll call gist reasoning. And the idea here is that there's so much information. Can we help people get the gist of it? The overall purpose of why I'm taking this drug and how to take it. So this involved adding summaries for people so that we could focus their attention on some of the key information. And the second one we'll call the good friction strategy. And usually, if there are product designers here in the room, usually we want to remove friction when we're designing good products. We want to make our products easier for people to use. And here, this is one of the cases where adding a bit of friction, we think is actually quite an effective, potentially effective strategy here. So here we wanted to slow people down and see if we can help them pay more attention and take a little more time on the key information prescriptions. So I'll show you what these looked like when we operationalized them in an experiment. So here's the gist reasoning strategy with a realistic pill bottle label and leaflet. So you can see it looks fairly similar to what we showed you before, but we really highlighted the gist. So you can see here on the left side with the pill bottle, metformin, this is for diabetes. I'm prescribing this because it helps control your blood sugar. Take 2 every day with food. There's a lot of what you need to know just there. And we think if people read that first, they can better interpret the information that they read after. And here's a basic outline of how we did the good friction strategy. We designed a prototype of what we called a commitment card. And we asked participants in our study to fill this out. So after they looked at that prescription label that we showed you, they filled out this commitment card, and it took some time. They had to say, why I'm taking metformin, chemical-main glucophage, and it will help too. You write this out in your own words, and then tap on the right side of your screen here, there's some of the contraindications and warnings. So we tested whether this commitment card could effectively slow people down and lead to higher recall. Okay, so with that, let me walk you through the details of how we did an experiment on this. So what we did is we went to Prolific and we recruited 985 people from their platform, and we recruited people who said they are taking a prescription drug. And they were, over representative sample of Americans who take prescription drugs, and we randomly assigned them, right? So they're going to see 1 of 5 alternative stimuli here, which are the pill bottle labels and leaflets. So in the control, we showed them the standard. So this is exactly what you would get if you went to your local drugstore and you filled out your prescription. We showed you that. In the second option, we showed them kind of what the medical researchers did, right? So they did some formatting and some chunking of information where they used some highlighting and some icons, right? So we mimicked what medical researchers had done in the past. And then we added our behaviorally informed strategies here. So number one was the gist reasoning that I showed you. We then, or the good friction was the fourth treatment that we tried, or we also tried a kitchen sink approach. And by this, we just mean we combined what we felt were the best elements from each of the strategies that are above here. So each participant was given labels and leaflets for 3 prescription medications and asked to remember the key information. They then did a delay task where they filled out some information about themselves and did an unrelated study, just so we could really test whether they remembered. And then they did a quiz, and we quizzed them on the key information about these. So we got a real, we were putting our money where our mouth is here. We got a real feedback on, did people actually remember? Not which label did they like, but did it actually move recall of the key information? So I'm just going to show you very briefly here all of the conditions that we show. So here's the control. This looks very familiar to anybody who's filled out a prescription. The formatting and chunking, this is what the medical researchers think is going to be so effective. The gist reasoning that I've already showed you. Good friction, we gave them the kind of standard labels and leaflets plus a commitment card. And here's our kitchen sink, where we felt like we combined the best elements from all of the above. We then quizzed them about each of the 3 medications that we showed them here. So we asked them basic questions, like the key information that we want them to remember. So can you recall each of the medications, the brand name, the chemical name, what it's for, what does it do, and what are some of the warnings associated with it and the directions. So with 3 medications, 6 questions per medication, we had a score from 0 to 18. So let me tell you a little bit about Prolific and how we recruited people into this study. So we screened people on Prolific, and in order to participate, they had to be a US resident, at least 18 years old, and take at least 1 prescription medication weekly, and pass a basic attention check to see if they were paying close attention to the stimuli we were showing them. And here's who we ended up with: 985 people, mean age of about 45 years old. We got a wide range from 18 to 85, 56% women, median income 40,000. So you can see, like, we're getting a pretty broad swath of the American population. For instance, if we look, here's a breakdown of their income. Some people worry when you're recruiting participants from samples like this, am I just getting the very poor end of the distribution? No, we're getting people across the income spectrum here. And here's where they are across the map. You can see our participants are spread pretty widely across all of the United States. Okay, I'm going to pause here, and I'd like you to make a prediction. At Irrational Labs, we like predictions, and we'd like you to tell us which one of these 4 strategies did the best, right? So by did the best, I mean the score that they got on our recall quiz. So you can see on the y-axis here, we've got from 0 to 18, and I've given you what happened in the control. So you can see each individual data point there is 1 participant, and then I'm showing you the average score there. And I'd like you to pop into the chat your prediction for which one won. I just want you to tell me which of the 4 conditions performed the best. And if you're feeling particularly bold, you can give a mean score next to it as well. All right, so we've got a lot of people like good friction. Kitchen sink, good friction, okay. Kitchen sink increased by 3% from CC there. Good friction, 13.5. Ooh, nice, okay. Kitchen sink by 20. You're giving us a lot of credit for coming up with good things here. Okay, last moment. Okay, I'll show you the results here. So this is what it looked like. So let's just look at this, in some detail here. So what does this all mean, right? So the formatting, remember what that was. This is what medical researchers have been doing in testing for decades here. We see no impact. The formatting of the labels and leaflets had no meaningful lift on recall scores. Our gist reasoning too. This is a strategy that Irrational Labs came up with. We thought it was going to work. This is why we test things, right? This is why you have to run a real experiment. There was very good indication that something like gist reasoning could be effective. We see no impact of the gist reasoning strategy. Where we do see an improvement is with the good friction. So, perhaps it was me putting my thumb on the scale a little bit, but you did very well with your predictions. We do see a pretty substantial lift in both the good friction and the kitchen sink strategies. They increased by 11% and 17% respectively. And then you can see, we measured this with statistical models as well, that these are not random noise. These are meaningful differences that we can measure in our models. The next thing we want to do is, why did this work, right? So we know good friction and the kitchen sink seemed to work. What was it here? And we thought it was about slowing people down, right? That's the intention of the good friction strategy here. So this shows on your y-axis, you see here the time they spent looking at the labels and leaflets. They were free to spend however much time they wanted here. And what we found was that the good friction and kitchen sink here, people spent significantly longer. It slowed people down by about 4 minutes on average, right? So there's a pretty big difference here. So, okay, we were successful in slowing people down. Did that matter? And what we find here, this is what we call a moderation analysis statistically here. So we see, did slowing people down, is that what moved the needle in their recall? Or was it something else about these interventions that was effective? And the takeaway from this slide here is that, yes, slowing people down partially explains the effects. It doesn't explain everything, but we do find that people who slowed down more were better able to recall here. So this is a good thing when you're running an experiment. You want to look at, did it work? And then what did it exactly change in the behavior of your participants? And then does that explain the results here, right? So what we think is that good friction was successful in slowing people down, but it's not just time spent. It may have been that, like, filling out the card, the act of doing that also helped people remember. And then perhaps some combination of the features in the kitchen sink worked well together, right? So this is good. This is good for kind of understanding the psychological mechanism behind what we're doing. So with that, I just want to think about what does all this mean? What is the impact of all this? And remember, this is a pre-test, right? This is a quantitative UX testing out of product, not, so these are not real participants who are trying to remember their real medication, but it does give a pretty good evidence-based indication that the good friction is a very promising strategy. And we can follow up on that with real experiments in the real world with real medication labels and leaflets, for instance. Whereas this is a good indication that we should not invest so many resources in the gist reasoning strategy, which, as I said, that was a very plausible thing that could have worked. But our takeaway from this is that good friction is the strategy that we should focus on more. And we could do things like pharmacies could provide their patients with physical commitment cards that they put into their wallet, if they have to fill them out and slow them down at the time of the pharmacy. And then they can pull it out of their wallet and remember some of the key information. There's also a lot of digital health apps out there that remind people of when to take their medication. Maybe they should have good friction elements as well. So we designed a couple things, like just to give a sense of what these could look like in a real experiment in the real world here. So something like this could be a physical commitment card that a pharmacy could hand out. And our early pretest suggests that something like this could be pretty effective. You fill out a drug that you're taking, you describe why, and the instructions and some of the warnings. And then here's an example of an app prototype that we designed. So we thought, okay, there's so many digital health apps out there. None of them were using a good friction strategy. What could that look like here? So here is a combination of the typical reminders, but also adding, on screen 3, also adding some of these good friction elements where people actually have to slow down and fill things out. Right. So here we've gone from an initial idea to something that really could be tested practically in the real world, and we think would be more effective than what medical researchers have done so far. So with that, I'll turn it over back to Richard.
So thank you, Colin. So again, we're really excited about this approach, quantitative UX research, and I think the experiment we ran really shows how, again, instead of just getting qualitative insights that are really hard to quantify on concepts, as Colin mentioned, that people think might be working, we can use this quantitative UX research approach to really quantify what approaches are most effective. And some of the ones that we might think or hypothesize would be effective might not be. So we wanted to give you a little bit of a sense for, if you wanted to run this, what would you do? So the first thing that we would recommend is defining a key behavior. And so again, you really want to understand what is it that you want someone to do, and you want to make that specific, measurable, and some sort of action. So in our case, we really were defining this key behavior as recall. So we wanted to test recall and make sure that we were designing an experiment where we could measure actual recall of information. And then generating behavioral insights. This is sort of where, again, you perform what we call behavioral diagnosis, but map out really all of the steps that it might take to get to that particular key behavior, and then identify the insights and create some hypotheses about what might lead to increasing that key behavior. Again, so Colin walked through a couple of different hypotheses that we had, really try to identify which of these are worth testing and how. And so that's where the experimental design comes in, where we say, look, let's try to design an experiment here and figure out, should we run an in-product experiment or should we run an out-of-product experiment? And if it's out of product, should we be running some qualitative behaviorally informed prototyping of an actual design? Should we run quantitative UX research as we did here? Should we run an in-product test? And we talked about a little bit of the trade-offs there, but thinking through, is this something that, we can get valid, insights from a quantitative UX study at a relatively low risk, something that's quicker, something that you can just get it right away, a representative sample, or is it something that you're ready to just go all in and test in product? And then come up with an analysis plan. So figure out, hey, how are we going to analyze this data before we run the experiment? How are we going to set up the conditions? What sort of sample do we need? And then predict the results. So Colin walked us through some predictions, and just like you, we aren't always right about what we predict. That's the fun of prediction. And then finally, launch. So again, launch your experiment, whether it's in product, out of product, recruit the participants. And then again, if you've designed an experiment really well, even if it doesn't turn out as you expect, you're going to have some useful results. So again, we ran this in the context of medication recall as this partnership, but we do this across all different contexts, healthcare, finance, tech, etc. And we'd love to help if you all are interested in designing or running your own experiments, or thinking about how behavioral science can improve your products. So feel free to reach out to us. And I think with that, we've got some time left over for questions, if anyone has any questions.
Wonderful. So I'm going to push some questions to you guys, and Colin and Richard, I'll maybe have you guys, I'll swipe. This is social permission for me to swipe if you guys are taking too long in the answer, because we do have a backlog in here. So feel free to be concise and funny, if you can do them both points. And so I will ask a question. Someone's requesting AI companion. I'm going to say not now to you, Matt, but it's not because of you. It's just the nature of the question. We're going to ask any differences in outcome by demographic segments.
I can take that. Yeah, that's a good question, right? So you want to look at who did your treatments work for, right? Not just did they work, who did they work for? We looked at a few things. We found that for older adults, it was more effective. So we looked at, based on age, were people, one, did age matter? Were older or younger people more able to recall their medications? And then two, did our treatment effects do better for older, for younger people? And they did a little bit better for older adults, but that's a great question, exactly the kind of follow-up analyses you should do.
Wonderful. And so I'm going to go to Julia's question as we kind of, can someone comment on using within subject design for quant UX research versus between subject variants? We're going to go to served methodology and then we'll switch to other. Colin, do you want to take a between or
Yeah,
within?
sure.
Just generally, maybe
Yeah.
overview what it is for folks who don't know, and then trade-offs.
Sure. Yeah. So within subjects analysis is you show multiple versions to one person, right? So you're looking at within person effects. You know, I give you the good friction strategy, and then I give you the the gist reasoning for another medication, for instance, right? Between subjects, every person gets assigned to one, right? Both are very valid ways of studying things, right? Often you want to look at things very much in isolation. You don't really get multiple different types of prescription strategies. Like our pill bottles look pretty similar. So in this case, I think a better strategy is between subjects. We also are contaminating. If I've just shown you one thing and then I show you something totally different, we worry it could be confusing. So within subjects, positives are you actually get even more statistical power. So sometimes you want to do within subjects so you can see like within the same person, this strategy worked better than another. Between looks a little bit more like the real world. So in this case, we went between.
Just kidding. We're going to move on to how did we arrive at the conditions? So gist and friction approaches. So Colin or Richard, feel free to jump in on this one because it was a labor of love for everyone.
Yeah, I can speak a little bit to this. So I think one of the insights, as Colin mentioned, is that other just simplification had been tried a lot. And as we asked you to guess, it had been tried and successful in some cases, right? These marginal gains of whatever 3 to 8%. In other cases, it wasn't effective. And so one of the hypotheses that we had was, is it going to be effective? Is it going to be effective or not? And when we thought about other options, and I think one question is like, what other strategies might you consider? We really tried to hypothesize what might get someone to actually remember these really because the drug name, right, and the actual medical name for the drugs are complex and they're difficult to remember. So we thought through behaviorally, how can we get someone to actually remember that? And that's sort of how we thought about the just reasoning and the good friction. And ultimately, we said, look, these seem like valid approaches that are worth testing separately, but if we combine, all that we can do, is there some additional lift from that? And so we really wanted to figure out, are any of these strategies on their own enough to increase medication recall? And then together, if we put together for a best case scenario, what could we do? So those were the two different things that we wanted to try to figure out, and that sort of informed our experimental design.
Yeah, and I'll maybe pile on to this that behavioral science really relies on prior literature to inform our starting hypothesis. And that's why we sometimes say it's a shortcut because we're starting with some level of understanding about decision making, and then we're applying it to the context that we're trying to solve. And so we're not drag and dropping some article into a product or a solution, and we're using that to do the ideation. In our team, sometimes we say there are bad ideas in brainstorms because there's so much existing research out there that we can build on that this could inform our hypothesis and decision making here. Great. And so we have a couple questions about like unintended side effects or consequences. Did it go up or down? I'm going to kind of quickly answer this. One thing that we do in these studies is look for some main effects, and that means that we're not always going to get some kind of backfire effects or other kind of downsides that would happen in the market. And so you're just always making a trade-off when you're deciding what to include or what not to include. Many times, and our team at Irrational Labs does a pre-mortem. So we think about what could go wrong if something, like if the result didn't turn out, why not? And by doing that, we outline some of the consequences or side effects or backfire effects. If we're concerned about them, we may add a condition. or we may add a variable that tries to understand if this is real or not. But in kind of the test and study design, it's an art and a science, and we can't add too much or else our power will go down. So you'll always have some trade-offs. Let's see, we're gonna go to John. Is there a real life follow-up? Richard, can you take this one?
Sure. Yeah. So as Colin mentioned, we're really excited about the good friction and ultimately kitchen sink results here that would suggest to us that, hey, actually, these approaches are things that we'd love to test in the real world. So some of you I saw had questions about, okay, well, what does this do to medication adherence? How do we tell whether people actually took their drugs? Well, obviously, in the context of this particular experiment, we're testing recall in a platform. We're not actually able to test, if we've given, right, we didn't actually hand people commitment cards or good friction examples that Colin showed. The logical follow-up would be, how can we build this in with a partner and actually test this in products? So if you have medications or you have a product, either digital or physical, that you're working on, and you want to leverage some of the insights here, we'd be happy to partner with you to figure out how would you leverage this within your product and how would we test it. And so again, we're excited about the possibilities here and think that leveraging some of these insights could actually impact medication recall and also potentially medication adherence. So those are definitely some experiments we'd love to partner with you on. If you are interested, feel free to reach out to us.
And kind of connecting the dots, if you're launching a product, this is a nice way to de-risk a solution. It would have been really hard for us to go to a pharmacy and say, hey, look, we have this good idea about filling out forms before people get the prescription. They'd be like, what are you talking about? That's crazy. Now we have some data, some insight that would de-risk the likelihood that this thing could work and how it would work. And so that's kind of the connection to what you're doing in your product, your marketing, your design teams. You're de-risking a solution because it costs a lot of dev and engineering time and PM time to actually launch something. It makes a lot of sense to put a little bit of time, effort, and resource into making sure it's the right thing. And that's kind of why we are so excited about this quantitative UX testing with Prolific, is that this is a relatively cheap and easy way to de-risk your big efforts. And not, I think one of the biggest things that we like at Irrational Labs is like, don't do something. So a lot of times, after you launch it, it's really hard to pull it back. And so just like Colin talked about, not doing the gist reasoning is as good of a finding as doing the kitchen sink. Because we would have otherwise invested in something that wouldn't have had the uptake, or likely wouldn't have had the uptake that we would have expected. Okay, there's so many other questions in here. Colin or Richard, do you want to pick one or two, and then I think we'll wrap, and we'll give Andrew and Richard a time to kind of close this out. This is like picking your favorite children or something. I'm not sure exactly how you're going to do it.
Go for it, Colin, if you have a question you like.
Yeah. I see Connor's got a question about instruments that you'd use beyond Qualtrics, which I could probably answer. You're right that Qualtrics is prohibitively expensive, unfortunately. It is for most people, and unfortunately there's not that many platforms out there that are capable of doing that really rich data on response time, latency. The two that I'd recommend, first of all, Gorilla Experiment Builder, which is built out of University College London. That's brilliant. I mean, even for people who don't want to code their own study or anything like that, it's more of a drag and drop, but very based around experiments, and also basically anything that open science tools make. So that's Pavlovia and PsychoPy. We work very, very closely with them, and they're both fantastic for that. So they should be able to get you the data you want.
Great. So I think with that, we are going to give it to maybe Andrew. Do you want to say if people want to integrate Prolific into their design and marketing their research lives, what is their first step?
Yeah, first step, probably just visit www.prolific.com. I believe Chloe's put somewhere in the chat actually a link that will allow you to sign up. So it's totally free to sign up and kind of explore. You never actually pay anything until you actually run a study, so you can explore everything we do. Yeah, jump on the website. If you want, I'll pop my email in the chat as well, in case you want to drop me an email. Just try and type at the same time as talking. It's not easy. But yeah, either drop me an email or visit the site, and yeah, that'll get you started.
And then Richard, if folks want to get in touch with us, what do they do? What's the first step?
First step is, yeah, send us a note. So here's my email here, richard@irrationallabs.com. If you're interested in learning more, we also have online resources, case studies, boot camps. We do trainings, workshops, and consulting. So if you're interested in learning more, figuring out how to apply behavioral science to your product, design a quantitative UX experiment, feel free to reach out and we'll be happy to talk more.
Great. We're going to send out, I would imagine we would also send out the Prolific white paper that we did together, which goes over all of these studies in detail. I think by coming to this event, you guys are maybe way beyond your peers in understanding kind of the interestingness and the excitingness of testing more. So, kind of one of the main tools researchers have in their toolkit is qualitative work. This is very good and helpful, and many times you want to have more people look at something, and so that's why we're excited about the quantitative UX testing, is that you can put a variety of conditions in front of people and quickly get results in a way that kind of could potentially predict behavior and kind of align with the behavioral science idea that we pay attention to what people do versus what they say they do.